Today, we will be focusing on one aspect of physicians' behavior that affects patient-physician communication, or rather affects patient satisfaction, according to the most recent research. Welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and IFM-certified functional medicine physician. Please like, subscribe, and share to help this channel grow. So medicine is looked as both art and science. And when we talk about medicine as science, it is quite straightforward because we usually talk about latest scientific research. And this channel talks a lot about that. And that's very exciting because it really offers something new in both detection of various diseases, including cancers, in diagnosis and treatment. And if you look back, for example, it used to be that gastric and duodenal ulcers, they were treated surgically, but now they almost never get treated surgically. They're treated with medications. So that's all a progress. And what science does also to us, to physicians, it also makes us humble because we can counsel patients and pontificate on some medical concepts day after day after day. And then the new research comes up that shows that we were wrong, and it's not a dogma. So everything we say is not dogmatic, and things change. And part of why I have this channel is not only to educate, but it also stimulates me to know more about the latest in medicine. It keeps us all humble. So that's the science of medicine that I think it's quite straightforward to understand. But there's also an art of medicine. So the art of medicine includes emotional communication with the patient. And that is, I truly believe that's 50% of medicine. It's as important as scientific part of medicine. It is as important as being able to offer this, my patient, the latest available in the medical field, the latest, the best, the state of the art. So emotional communication is extremely important. So there's several components of that emotional communication, and some of them are obvious, such as empathy, compassion, trust. There also has to be clear communication. There has to be an active listening on the doctor's part, of course. There has to be patient involvement because the decisions have to be shared, and they should not be unidirectional, just coming from the physician. There has to be a consistency and um, and a reliability of all of the decisions and all aspects of the communication, and also, of course, confidentiality. So all of these aspects of emotional connection are important. And I think that our job as physicians, and I say physicians, but I mean providers, all of us, physician assistants and nurse practitioners and everybody else. So forgive me if I sometimes just say physicians only, but I do mean providers. Our goal is to strive for perfection in this department. And I think there's nothing wrong for strive for perfection. Most of us never achieve it, but we should strive for that. So on that note, I'm moving to today's study that is a very interesting, actually, study. So what they have done, this study has been done at the hospital. And so it's an inpatient study. It's not an outpatient study. And in that study, they basically first had the chair in the room. And usually in most hospital rooms, there is a chair in the room. So, and the chair in 50% of the time, the chair was placed right at the bedside. And at the other 50% of the time, the chair was placed a little bit away. And you probably have seen in many hospital rooms, the chair is often basically is by the wall someplace, or by the window, because sometimes there's just not enough room for a chair. But usually there is a chair. So basically the chair was either at the bedside or either at the wall. Then the doctors, and they looked specifically at the doctors, and essentially it was 50-50, male, female doctors, and the average age was 35. And they looked at 125 clinical interactions. So what was that clinical interaction? Clinical interaction was that the doctor was coming in and interacting with the patient who was in bed, actually in the bed. So, and none of the participants knew of the objectives of this study. So then what they started looking at, they looked at, first of all, whether the doctor was sitting in the chair. So interestingly, they noticed that if the chair was was placed at the bedside, then the doctor was more inclined to sit at that chair. So, and the number is 6 out of 10 times the doctor would sit in the chair. If the chair was farther away by the wall or just farther away, then it was 1 out of 10 times. So then they looked at the criteria, so the result of that. So the result was this. The result was patient satisfaction and also patient's confidence with proposed treatment plan. And so they noticed that when the doctor sat in a chair at the bedside, the confidence and the satisfaction was 72%. And when they stood, so when they didn't sit at all, it doesn't matter where the chair was actually, it was 52%. So again, sitting was 72% and standing was 52%. So that is a statistically significant difference. So that has shown that sitting at the bedside is better for patient-physician communication. It actually improves patient satisfaction and improves patients' confidence in their treatment plan. So is it so surprising? I think it's not surprising because we all like to be attended to, and especially when we're sick, we want somebody to listen to us, to attend to us. So somebody sitting conveys a more caring attitude than somebody who's standing and who is in a hurry, which is a lot of us all the time, essentially. And also, I am looking at it from the physician's standpoint. And I just imagine, because I just see it all the time, that's just the reality of life, how you have a doctor who's surrounded by, attending doctor who's surrounded by multiple medical students and residents, and they group of 5, 6, 7 people just kind of coming into the room. Patients is often woken up. Of course, there's just no opportunity or not even an idea of sitting because it's quick examining or checking the incision or checking this and that. How are you feeling? And quick, and move on to the next patient. So it does happen everywhere. Well, maybe, I don't know, maybe not everywhere, but everywhere that I have seen. And why does it happen? Because of the time restraints. And then I started analyzing this, and I realized that every time I sit down at the bedside or I see my colleagues sit down at the bedside, it usually means something bad. So, in a doctor's interpretation, when I see a colleague sitting, I know that they're usually delivering bad news. And similar with myself, so it's either a bad news that's being delivered, which is common, unfortunately, or it's a difficult concept that has to be explained. For example, if you explaining how the surgery will be done. Sometimes I draw some pictures just to show, and that I sit down. So yeah, and that's maybe it's a little sad, but that's a reality. Just thinking about all the incidents that I see myself and my colleagues seen it in many cases, and not each time, not everybody, but it is very common. Again, this study was done in inpatient setting, and it's not such a huge number. It's only 125. So, but it is important to understand that this is a statistically significant difference. So then I extrapolated this to my outpatient manner. So how do I conduct myself in the outpatient? And in the outpatient, there is a similar sort of idea, because when I interact with a patient on an outpatient basis, I'm usually standing because I'm very active and I don't like sitting. So I usually have a iPad that's on the stand, and I do everything standing, and I walk around examining the patient. So I like to be active. So if it's something light-hearted or if it's a routine, then I stand. However, if I'm about to deliver a bad diagnosis of cancer and start explaining what needs to be done, then I sit down. Additionally, I notice that intuitively, I always sit down when patient is about to share something painful or unpleasant. In a functional medicine setting, when I do an intake, I'm always seated because there's a lot that comes up, and that's different just compared to, for example, a cyst removal. That's a very different appointment. So I think that it's good to follow your human intuition in these types of things. Of course, ideally, I think it's probably the best to probably sit down for each encounter. But it's something to think about, because I think this is an eye-opening research, and I think that more research of that kind will be done, and hopefully for a new batch of doctors, maybe their conditions will not be as rushed, and they will be able to sit more and engage more with the patient, because I truly believe that medicine of the future will be much more um, human friendly and much more time generous, allowing to spend more time with the patient. Because if I know that I'm allowed to spend more time with the patient, then I'll definitely sit then. So very interesting research. Thank you so much for watching. And if you enjoy this channel, then please check out my book, The Clear Skin Diet: Unlocking the Secret Link Between Food Sensitivities and Skin Health. Thank you so much. Bye-bye.